Hi guys, welcome to another video. Today I want to talk about my teeth and my surgeries that I had to have and the implant and everything. I made a couple of videos about this back like 3 or 4 years ago, and I keep getting a bunch of questions on them. So I want to go over my most asked questions. So I'm just going to go off my phone, so sorry if I'm reading off the comment. Did they have to do anything to your retainer after? I also had the same issue. They had to shave down my retainer to make it fit in my mouth because I was still swollen. And because the bone actually takes up some space, it is gonna eventually stick out a little further, so you will have to have that retainer shaved down. But right away there is a lot of swelling and that will eventually go down. My surgeon actually shaved down my retainer, but if your surgeon doesn't do that for you, then I would go to your orthodontist if you have one, or your dentist. When they took out your sutures from the bone graft, did they see any gum layering? So I'm guessing the gum layering is because the type that I got done is they take a chunk from the roof of your mouth and then they put it under your gums. So sometimes that gum that you naturally have there, you'll be able to see that other gum under it. None of that was seen at all. You guys, I can do a close-up on my mouth later, but like it's all healed and it has been like this for a very long time now. No complaints about gum layering at all. I know the pinhole technique is supposed to stop gum layering, but I didn't have any. What is gum grafting? Adding skin from another part of your body to your gums. Gum grafting is taking a piece of gum from another piece of your mouth and putting it under your gums. So they took gum from the roof of my mouth and they put it under to cover my teeth properly. I'd rather have cow bone than cadaver bone, like my info pack mentioned. And I actually commented back that, yeah, they can do either of those, or you can have your own bone harvested. And then somebody actually added on to that and said you can even have your hip bone implanted. There's many possibilities. So yeah, it just depends on what suits you. That's why I said I personally would prefer to have my own bone in my mouth, but I have bovine bone. Cow. How much was it? It basically added up to the same amount as how much my braces costed me, which was $5,000. So I guess every surgery was about $1,500. But I had 2 surgeries in one, so we did save a little bit of money there because I only had to be on one thing of painkillers and one thing of antibiotics. I didn't have to be on 2 because I only had 1 surgery. Well, I had 2 surgeries, but it was all within 1 surgery. It wasn't separate times. My stress is bad after a bone marrow surgery. It's been 3 days. Go to your doctor, please. Yeah, I don't know what bone marrow surgery is because I didn't have that. We're talking about bone grafting. Yeah, you might have an infection or something. Go to your doctor. Does it hurt? My dentist told me I might have to get that at the top. No, it kind of depends on your pain tolerance. For me, it didn't hurt. Like, I was doing normal activities after. I mean, I couldn't move as fast because you're not supposed to move, and like exercise and stuff, follow the guidelines, but I felt like pretty much right back to normal after, and people were shocked that I was able to talk, able to do stuff, and yeah. So for me, I was okay, and I'm sure other people have the opposite or the same. How long did it take to heal? So I had my first surgery done, and then they waited 6 months to do the next one. And then after 6 months, I had a checkup. I was all healed, and then I had another checkup a year after to check again, and I was still all good. My surgeon is actually wanting another checkup now. It's been like 4 years or something, so if I'm back in my hometown, I will be doing that. Yeah, everything has been good as far as I know. I can't see x-ray vision or anything, but the outside's been good. Can't tell it's an implant. I forget it's there all the time. I'm telling people I have an implant and I'm poking the wrong tooth, telling them, and then I realize I'm at the wrong tooth. So for me, it only took at the most 6 months to heal, but I was probably healed before that period of time. That's just when I saw my surgeon to confirm that I was healed and ready for my next surgery. They have a synthetic now they can use instead, instead of cadaver or bovine. It's made with platelet-rich plasma. That's cool. I'd go for that or my own bone. Looks like you need some chapstick. Looks like you haven't seen my video. Did they do both procedures in one day or separate? So I had 3 surgeries, but 2 of them were within one because he decided after finishing the first one that, hey, she heals fast, let's go ahead and do the second step. So yeah, the whole procedure of having an implant might be able to be done in one day, depending on if you need a bone graft first. I needed a bone graft and a gum graft before I could get my implant put in. That's why I had 3 surgeries. Some people only need to just get an implant put in, and they just need like their tooth shaved down into a peg. I didn't have a tooth, so I had to get the screw put in first so they could attach the peg or the crown to that. So it was 2 surgeries. I went in 2 times under the knife, but one was longer because they did 2 in 1. I just had gum grafting 2 hours ago. I will have bone grafting after 6 weeks. Did the doctor take the bone from under your chin? No, my doctor didn't take my bone from anywhere in me. There's lots of options with that. I'm just not gonna say anything to this one. It's just kind of funny. How come you lost your tooth? I was born without a whole bunch of teeth. Yeah, no accident or anything there. My mom has a cleft palate. My cousin has a double cleft. So it just genetically is in my family that I was gonna be missing a couple teeth. So I believe I'm missing 6 teeth, I was told once by my dentist. I've counted the teeth in my mouth and I only have 23. Add 24 because I think I have a wisdom coming in, even though I was told I didn't have any wisdom teeth, but I think I got one. So I have like 24 teeth instead of 32. I also had a lot pulled though when I was younger. So how many surgeries did they have to do? Like I said, they had to do 3 procedures within 2 surgeries. Why did you have the gum and bone graft done? Like I said, I'm missing a lot of teeth. So the gum grafting I needed done because I didn't have enough thickness of bone. I had an x-ray done and there wasn't enough thickness that if they put that screw in that it would hold that crown of tooth in. So they needed to add bone in first. After the bone was in there, they were able to put a peg in, but then they noticed that my gum was non-existent because I never had a tooth there, so I didn't have extra gum. So they had to take gum from the roof of my mouth and do the gum graft. Was the name of the mouthwash you were given called Parogard? Yes, it was. Does it need to be prescribed by a doctor or a dentist, or can it be purchased? It needs a prescription to get it. How is the recovery in terms of swelling or pain afterwards? I hear there may be bruising. I didn't have any bruising on the outside of my mouth. If you looked at me, I would look the same as I do today. You couldn't tell I had surgery other than the fact that I'm like not moving my mouth as much, because every time you move your mouth, every time you laugh, it hurts. That was where most of the pain was. Eating, you figure it out. Within 2 days I was back to normal. I could eat normal stuff, I'm pretty sure, and it was all good. You'll probably eat a lot of softer foods just because every time something hits your stitches after a bone graft or a gum graft, or even an implant, it's just gonna feel more sensitive, so you can chew on the other side and still eat that solid food. It's just easier if you only have an area of your mouth that's been done. Some people have like their whole mouths or something done, and it's like, how do you eat? Like, you're probably on an all liquid diet. And where that tooth is, mine is right at the front of my mouth, so I was able to get it past the front and, you know, onto the side, and it was good. When you're eating too, like, you feel your stitches come out with your food sometimes. Like, I'd be eating a food and I'd feel it do a little pull, and the stitch is gone and I've swallowed it. And it's all good because they were dissolvable stitches, because they know that's what happens. I ate a lot of cold foods because it soothes the mouth, because it's very warm feeling, just because the surgery there's a lot of blood that went there, and because of that they don't want you moving around too much, because that blood can easily just come back out and you can experience more bleeding. So if you start having bleeding, because I had that before, just slow down, stop moving, rest, and it will stop. If it doesn't stop, go to your doctor or the emergency room. Are there any side effects you experience after a bone graft? The only side effect I experienced was the pain, like with doing certain stuff, but for the most part I had a really good experience and a really good surgery. How painful is it going to be taking out the thread? So I, for some reason, got really faint after they took out my stitches, and I like had to have some sugar and relax a bit, and then I was fine. They didn't give me any painkillers or anything, so I just went in to the office, sat on a chair, and he ripped them out. I know that sounds bad, but like that's what it felt like for me. I just found that painful. I didn't find the surgery painful. I didn't find the healing painful. I just found getting the stitches out painful. Not everybody's gonna think that's painful. Is bone grafting gonna last your lifetime? Yes, it should. Did they drill while having the implant on? Or bone grafting? I was born without the tooth, so I had nothing there when they did the bone grafting. I had nothing there when they did the gum grafting, except they did 2 surgeries in one. They put the peg in, and then they did the gum grafting around the peg to make sure that I had gum over the tooth. Did they put you on antibiotics? Yes, they most certainly did. I had a surgery. The antibiotics were given to me so I don't get any infections. Definitely take all of your antibiotics, because if you don't and you get an infection, that's your fault. I don't know what else to say to that. When they put the peg in, did they give you another course of antibiotics? They gave me 2 courses of antibiotics because I had 2 surgeries, but I had 3 procedures. Does that make sense? I have insurance and it does not cover any of this except extractions. I am $15K in the hole for 2 teeth replacements. I don't know where you live, but that's crazy, because for me, $15K would cover all of my teeth. Like, you can get all your teeth done for like $10K. So I don't know where you are and where you're going for your teeth, but you need to go somewhere else. I'm sorry. Yeah, my insurance didn't cover any of my surgery either. Mine only costed $5,000 at the most, so I wasn't in the hole. That was how much my schooling costed. So my teeth, one tooth costed my whole schooling. I can't believe you need bone grafting at such a young age. I'm having it done at 50, so I don't feel so bad. I think anybody can get bone grafting done. It's really just anybody who's having a loss of bone or born without bone like me. How bad was your bone loss? From 1 to 5, how advanced was it? Were you able to save your teeth? How is it going so far? What care do you have to do long term? I didn't have bone loss. I just didn't have a bone there in the first place when I was born, because I was born with a lot of genetic mouth issues, missing teeth. And because I was missing teeth, my jaw up here never had enough bone to support a tooth. So that's why I had to have the gum grafting done. It wasn't advanced because it wasn't actually tooth loss. I still got all my teeth except for the ones that they did pull a couple to make some room. That was way before my surgeries. Long-term care is just making sure I floss around it and clean it to make sure that it doesn't cause the teeth around it to become decayed. You need to stop building up a habit of biting your lip. I promise you, I do not have a habit of that. Can you eat everything like apple, steak, corn on the cob, and chewy things like Airheads? You could eat corn, but not on the cob. It would be easier for me to eat it with a spoon because I was trying to go around my tooth. Apples, if they were soft, like maybe an apple crisp, you could. Probably could eat Airheads. You just have to eat it on a spot where it's not happening to your teeth for it to work. How old? I, at the time of my surgery, would have been 16, I think, because it was before prom. And now, 21. Do you brush it like a regular tooth? How does it feel after this long? Yeah, you brush it like a regular tooth. You just have to floss around it and make sure, well, you floss all your teeth, so just floss all your teeth are really good. But you have to go up a little higher with your implant to make sure nothing is up above your gum line. How does it feel after this long? It feels completely normal, fine. I can't even tell it's there. Sorry, my camera's jumping. Sometimes in the winter I could feel how cold the metal is, but eventually that stopped. And that is all for my questions, guys. I hope this really helped you because there's been lots of questions on that video. So I wanted to make a video that had a little more information because I made that video a long time ago. So I hope this helped, and I'll see you in another video. Goodbye!